Thanks, Jen, and good afternoon, everyone. Good to be with you again. One of the things that is really important to me is to rebuild the trust that was destroyed, frankly, by bad actors making fraudulent Medicaid claims. Minnesota didn't just lose money, we lost the confidence that the money we're spending is going to our neighbors and loved ones for life-saving and life-enhancing medical care. I'd like to start today's briefing by bringing you up to date on our efforts to provide the Centers for Medicare and Medicaid Services with our corrective action plan for combating fraud. A major part of that is our plan to revalidate every one of the 5,800 plus Medicaid providers in the 13 high-risk programs by the end of May. This involves a few things. First, reviewing providers' documentation. Second, reviewing owners' background studies. Third, visiting these providers for on-site screenings. And fourth, conducting screening reviews before and after visiting the providers. In truth, this work isn't new for us. It's an ongoing task. Every Medicaid provider is revalidated on a regular schedule, but right now we need to pull out all the stops and assure ourselves and the people of Minnesota that the providers of these services are qualified and eligible to carry out their work. This is as much for providers' benefit as it is for everyone else. We can't let the cloud of fraud hang over the good work that's being done every day, and we can't let that hang around one day longer than necessary. This week, we're making a call out to Minnesota's 40,000 state employees, and we need 168 people from across the state to come into DHS and help us perform unannounced site visits. Training for this work will begin in February, and inspections will start soon afterward. Providers in all 87 Minnesota counties will get unannounced visits as a part of this. This is an unprecedented effort. We've never done anything on this scale before with provider revalidations, but the people of Minnesota deserve this level of effort so they can be confident in the programming that we offer. Minnesota Revalidate, as we're calling it, is a cornerstone of the work that we're doing to combat fraud. The people who stole from Medicaid didn't just take money from our neighbors in need. They robbed us of some of our confidence that we can care for each other. But we know all Minnesotans care for each other. We see it with our own eyes every day, right now. We're engaging with CMS to demonstrate the work that we're doing to combat fraud in Minnesota, to build trust and make Minnesota a national leader in program integrity. Here's a quick summary of the process we've been engaged in with CMS. Over the past year, we've been working to address fraud in multiple areas. We found their feedback to be helpful and have implemented their recommendations. We've done everything CMS has asked us to do, in fact. We worked with them closely as we evaluated the viability of the Housing Stabilization Services Program and ultimately closed it down. At CMS's recommendation, we disenrolled non-active providers from 14 high-risk programs. We're now regularly disenrolling all providers who have not submitted billing for 12 months. Just last week, CMS approved our plan to pause new provider enrollments while we review our processes. And since December 5th, we've been working with CMS to create a corrective action plan that will increase our ability to prevent and detect Medicaid fraud. CMS replied that the plan we submitted in December was inadequate in their view and is planning to withhold up to $2 billion a year in federal Medicaid funding. We were given until January 30th after that notification to either revise our plan to their satisfaction or to appeal. We're doing both. We're particularly concerned that CMS did not conduct a recent audit to support this decision. It relied on off-topic and out-of-date reports from 2017 to 2021. Those reports are not relevant to the issues currently facing our program and our state. Additionally, there are no facts to support withholding all funds from 14 programs. Even if there is a finding of non-compliance, the withholding must be based on specific findings. CMS's recent actions create the appearance of a punitive action instead of a partnership to combat fraud. A simple Google search would have dispelled one of the concerns raised in the CMS letter. The claim that we don't have means for reporting potential fraud, waste, and abuse to be investigated is not correct. We have a tip line, a web form, and an email box, which have been in place for some time. Even though we don't agree with CMS's conclusions, we are moving ahead with the recommendations they've laid out. Last week, we paused enrollment for new businesses to start providing services in the 13 high-risk categories. And now we're launching a statewide effort to be on site at the 5,800 providers I mentioned during the next few months. We can't provide the services Minnesotans rely on without CMS's help and support. They are our partners in carrying out the mission assigned to us by Congress and the Minnesota legislature. And we look forward to continuing our partnership to provide life-saving and life-changing assistance to Minnesotans that is required by both state and federal law. We want Minnesota to be known as the best state in the country for Medicaid program integrity. And with that, Jen, I'll turn it back to you.
Thanks so much, John. Great information. We appreciate you giving us a roundup. So we do have time now for a few questions. As I mentioned before, in addition to having John Connolly here, we have Inspector General James Clark available. So please raise your hand using the push button at the top of your screen, and I will acknowledge you to come off mute. So we'll get started with Renee Cooper at KSTP. Renee, you can come off mute.
Hey, John, thanks for taking questions today. Going off some recent reporting, it seems Optum is only contracted to analyze Medicaid fee-for-service claims, but data from the Minnesota Council of Health Plans and CMS is showing us that over 80% of Minnesota Medicaid members are enrolled in managed care, which seems to lead to the conclusion that Optum is likely reviewing less than 20% of total claims in these programs for possible fraud. Is that fair to say? I mean, how many or what percentage of these payments to these programs are being made by DHS and how many are being paid by insurers? And why would a prepayment review process meant to get a grip on the scope of fraud in the state seem to leave out a significant fraction of claims that could be possibly fraudulent?
Thanks, Renee. I appreciate the question, and it's a good one. So you are correct that the current scope of the enhanced prepayment review that Optum's engaged in with us is for 14 high-risk services in the fee-for-service program. So that is correct. But we have always seen this as a starting point. I think we will engage in a process to identify a longer-term vendor through an RFP, a procurement process, to do this work more broadly across the program and longer term. And I think in addition to going beyond the 14 high-risk services within the fee-for-service program, we are identifying areas where we can do more to ensure that this type of work is being done within managed care organizations under contract with the department for medical assistance. I should note that the fee-for-service program, though it has about 20% of the enrollment, the people in the program, and MCOs have 80 to 85% of the enrollment, the spending is split more evenly between the two, however, just by nature of the different services and the types of folks that are covered in those parts of the program. But you are correct in kind of outlining the contours of the program and who is covered where. But again, I'll reiterate, this is really a starting point. We identified these as high-risk services to start with. It's a place to start the enhanced prepayment review process. We eventually want to include the entire program in that. Some managed care plans are already doing that, though not all of them. But we hope to have the entire program covered as we expand enhanced prepayment review across the program.
But just as a follow-up to, I mean, is there a reason why DHS would not go ahead and have Optum reviewing all claims? I mean, we're not reviewing even the majority.
That is a fair question. We have to start somewhere. This is a new enhanced prepayment review process for the department. It was launched a little more than a month ago. And we are really trying to learn and insert a new business or create a new business process for ourselves internally. We have a vendor that we have engaged to do the work with us under contract now for a year. And we will extend this work more broadly and beyond that first year after we complete the procurement. But the idea was to start with the high-risk programs and to get started, learn the process. And of course, we have humans, professionals within the department reviewing all the claims that are flagged and studying them for potential risks and following up as needed. So this is, again, it's a new business process. It's a new way of doing business and proactively preventing fraud. And so to make sure that we're doing this in a way that is thoughtful, stepwise, refined, but also recognizing the urgency of what we're getting our arms around, this was, we felt, an implement for us at DHS, and we'll expand upon it.
Is there a holdup though? I'm so sorry for hijacking here. I mean,
Mhm.
in terms of, I mean, even within these 14 high-risk programs, we're saying 80 to 85% of the claims are handled directly by insurers. Is there a prohibitive reason why DHS wouldn't have gone ahead and just been reviewing all of these claims? Is there a reason why that would be extra steps, that this could not have all been rolled out at once?
Well, I think we need to actually create and refine this new business process for ourselves. And again, we've just started this weeks ago. So I think to do this in a way that recognizes the enormity of the shift here, this is a watershed moment, like I said, for the department and how we're doing business and preventing fraud. We need to identify the highest risk services and make sure that we're doing the work there first, intervening as quickly as we can, but of course doing it in a way that's intentional and organized, and that's what we are doing. And I think once we have started to get our sea legs under us in that process, getting that refined and operational, we will expand upon it. And I think we are at this moment also actively engaging, across our different teams, how we can expand this to our work with managed care plans, and how we can look at what we're learning and look at what plans can do above and beyond what they're already doing. So I think we are looking to expand. We want to make sure that we implement this in a way that's thoughtful, intentional, and is thoughtfully, restructuring the way that we process claims and pay providers.
Thank you.
Thanks, John. And thanks also to you, Renee. Let's move on to Alyssa. Let's try to keep it to 2 questions, guys. We've got quite a few folks with their hands up, and we want to try to get to everybody if we can. So, Alyssa, if you have a question, then a follow, go ahead.
Sorry, I got distracted. I have follow-ups to Renee's question also, but one question is, what is different about the corrective action plan that you guys submitted January 30th compared to the previous one? And then also, okay, I think this has been asked before, but could you just clarify what the $2 billion is? Is it for the 14 Medicaid services, or is it for Medicaid in general?
So I'll start with the corrective action plan and how the iteration we submitted on Friday looks different than the one we submitted on New Year's Eve. And then I'll get to the second question in a minute, but you might have to remind me of that as I give you the first answer. So with respect to the corrective action plan, so with what we submitted on New Year's Eve, we responded to the items that CMS requested in the December 5th letter from Administrator Oz to the governor. So those items were responded to, they were agreed to, in addition to other items that we already wanted to work on. So we included everything they asked for and then went above and beyond and included additional items. So we were a bit surprised, I think, by the characterization in the January 6th letter that we did not really hit our marks with respect to the items that CMS was looking for. There were several items that were in the follow-up letter from Dr. Oz and mentioned in the video that we did then respond to in the submission that we offered on Friday evening. So we again included all of the items that were listed in the letter on January 6th, have responded to those, tried to be very clear about milestones and timelines and ways that we will be held accountable with respect to those things in the revised corrective action plan. So we're speaking to things like managed care oversight, staff and provider training, for example, and provider revalidations and how we're doing that work, which is the major item we're talking about here today. And could you repeat your second question? Sorry.
Yeah, thanks. The second question is, what is the $2 billion withholding for?
Yes, yeah. So basically, CMS, in frankly an arbitrary way, identified this $515 million quarterly figure or $2 billion annual figure in withholding, and that is a broad withholding. They based the number. They just said we're gonna withhold 25% of the value of the 14 high risk services. That was really what they based it on. Although we think it was an overstatement in our estimation. According to our calculations, that is a higher number than actually 25% of the billing for those 14 services. I think that's an important point to offer. But the withholding is what it is. It's the amount in terms of federal matching funds coming back to the state on a regular basis that's going to be withheld from us. So it's based on something related to the 14 services, but we receive federal matching funds in a large, in a large payment when we submit claims for those funds. So it is a broad financial impact to the Medicaid program, but really to the state more broadly, should it come to pass.
And sorry, what is DHS's calculation or estimation of the amount?
Closer, a little above 300 million would have been the 25% of the quarterly amount of billing for the 14 services.
Thanks.
Great. Thanks, Alyssa. Let's go to Christina Morales at the New York Times. Welcome to the call.
Thank you so much. Just had a question about the federal prosecutors who've resigned. I'm wondering if you all have seen an impact on fraud investigations based on all of the federal prosecutors who have resigned. Have you noticed any sort of disruption in your ability to provide information or collaborate on this?
I might refer that to James. I don't know if you have anything to say in response.
Can folks see and hear me?
Yep, we've got you.
We can.
I would say we haven't seen any additional charges brought from the U.S. Attorney's Office here since the recent wave of resignations has been announced. I will say also, I haven't received any communications from the U.S. Attorney's Office about ongoing investigations or prosecutions or collaboration since the resignations have been announced. My most recent meeting with attorneys at the U.S. Attorney's Office was, I want to say, back in December at their office in downtown Minneapolis. We had a very productive conversation, talks about future collaboration and information sharing. Unfortunately, I think all of the attorneys I met with in that meeting have since resigned from the office, and I haven't had any follow-up from folks at the U.S. Attorney's Office since then.
Thanks, James. Let's move on to Anna Radelet at MinPost. Go ahead, Anna.
Yeah, thanks for doing this. So the $2 billion, how much does the state get in Medicaid funding every year? And when you're looking at the fraud in the 14 programs that are high risk, and I know you haven't, audited them completely, but is the fraud coming more from the fee-for-service side or from the managed care side?
So I might start.
Okay,
I'm sorry.
Go ahead. I'll have a follow-up. Yeah, thanks.
So I might start with the first question and then maybe work with James on response to the second in terms of where we're seeing credible allegations of fraud. With respect to the financing from the federal government, so this is a slightly over $20 billion program, medical assistance in Minnesota, and the federal government pays for just over half of the program. So we can get you a specific number. We can have an absolutely specific number in terms of federal matching funds that we've received in the most recent fiscal year, for example. But if doing the back of the envelope math, it's going to be slightly more than half of $20 to $24 billion roughly. So it's north of $10 billion in terms of federal, or $11 billion that we receive in federal matching funds annually.
And the fraud, is it more likely in the managed care or the fee-for-service side?
James, do you have thoughts about that?
I don't have the exact number. I would say we're seeing it's mixed, right? There's fraud and fee-for-service, there's fraud in managed care. Oftentimes, it depends on the program and where funding for that program is coming from. For instance, housing stabilization services, which was a program that was on everybody's mind in the spring and over the summer. That program, I want to say, was funded at about a 90% managed care rate. So a lot of the fraud we were seeing in the news, recipients saying they had never heard of this provider, fly-by-night providers, the vast majority of the fraud that we saw in housing stabilization services was happening on the managed care side, because that was a program that was by and large funded through managed care dollars. Now, what I will say in terms of managed care, right, we contract with every single managed care company in the state, right, and they are responsible for detecting and preventing fraud, waste, and abuse in the dollars that we give them. So they are supposed to have robust detection systems, fraud prevention systems. They're supposed to detect and prevent it, refer cases to prosecution, just like DHS is. So the same kind of responsibilities that DHS has in terms of detecting, preventing fraud, referring suspected crimes to the Attorney General's office, managed care organizations have those exact same responsibilities and are supposed to have the exact same administrative functions and capabilities in order to complete that work.
Okay, and my follow-up is you've decided to comply and appeal to CMS. I guess the appeal would go to CMS itself. Have you gotten an indication of where they stand on freezing the funds? Is this enough to put off freezing the funds, or are they going to follow through?
So what we know at this point is that they are pausing on freezing the funds or withholding the funds while the appeal process moves forward. So at this point, they haven't begun to withhold the funds, though they've indicated an intention to do so.
Okay, thank you.
Thanks, John. Let's go to Jesse Van Berkel at the Star Tribune.
Hi, folks. I'd like to get a little more clarity and context on this new site check push. So to make sure I've got it right, there's 5,800 organizations operating in those 13 high-risk programs, and then the state is pulling together 168 additional or total state staff to do these unannounced site visits. And then could you talk through, how many people were doing this work previously and how often site checks were happening, and any efforts to try to make sure that you're doing more of those going forward?
Sure. So I'll give you an initial response, and then James, since he and team handle the on-site visits, might give a little more texture in terms of existing staff. But the first answer I'll give is that these would be 168 additional staff from across the state enterprise. So these are our new staff doing the work with respect to the site visits in particular. And James, I don't know if you want to say a bit more about the existing staff we have doing the work to give some context.
Yeah, I would have to go back and pull those exact numbers, John, but it's nowhere near, right, 168 additional staff that would be needed to complete these site visits. What I will say, revalidation site visits is a routine part of our work, right? Every provider, right, depending on their risk level during enrollment and during revalidation. So providers are revalidated typically every 5 years. If you're high risk, every 3 years, right? We do this process, the exact process that John laid out, right? Verifying ownership, verifying credentials, verifying background checks, doing unannounced site visits to make sure you're operating at the location you say you're doing. So we do that as a part of our regular work. We just do it at a much smaller scale than what we're being asked to do here in terms of essentially doing unannounced site visits, doing all that verification work for like 6,000 providers between now and May. So we have a much smaller group than 168 that is currently doing that work. I don't know the exact number. I would have to get back to you on that.
Great. Thanks for the question, Jesse. Let's move on to AJ at CARE. I can see that we're not going to get to everybody's questions, so we'll see how long we go here, AJ, and then we'll try to get to the next person if we can.
My question is regarding prepayment review. In a Senate hearing last week, DHS said no instances of fraud have been flagged through this process. My understanding is Optum is just reviewing claims data and, in essence, paperwork. If the paperwork on the claims have their I's dotted and T's crossed, how would they even be able to spot the fraud that we and Inspector Clark have found most prevalent? Billing for services not even provided.
So thank you for the question. I think it's a good one. And as we said last week, we just got started with the process, and this refers back to Renee's question too. And we are, starting with a limited number of tests applied to the claims. I think, I've said this in some other briefings about this topic. 14 in the first 2-week round of payments. 14 tests were applied to those. We went up to 28 in the second round, and then I believe 54 in the third. So this speaks to, again, our ramping up of this process. And as I said, with respect to Renee, in her question, we do plan to expand to all of the fee-for-service program and are actively looking at what MCOs are doing in terms of their prepayment review practices and other program integrity practices to make sure that we're tightening up across the program in all respects. And there will be ever expanding work, I think, with respect to prepayment review in the coming weeks and months. To respond, AJ, more directly to your question about the hearing last week and the referrals to the OIG, again, because we had a smaller number of claims that were flagged because of the smaller number of analytics, as we call them, or tests applied to those claims, that's increasing with each 2-week batch that we're looking at. We expect that we will identify more flagged claims, and the system, Optum system, will learn as we go through those 2-week rounds and get more sophisticated at identifying concerning problems, or concerning patterns rather, in terms of spikes in billing, remarkable consistency in billing that doesn't seem clinically appropriate, things that don't feel clinically justified with respect to the type of person being served based on, again, their clinical presentation or age. So the system will learn as we go. And I think as provider billing patterns become more understood by the system, there will be more referrals from staff to the Inspector General and team for investigation. As again, I think we learn more about what the system is flagging and what the concerns are.
Thanks, John, for that. I think maybe we have time for one more question, do we? Let's go to Tori at Axios. We'll try to make it a quick one here. Go ahead.
Yep. Yeah. Two quick follow-up questions. First, Inspector General Clark, when you mentioned your lack of communication since the resignations with the U.S. Attorney's Office, would that be normal or typical? Like, think back to December, November. Would you have gotten communications with them over, what would this be, like a 2 to 3 week period usually? That's question number 2. And then for Director Connolly, just to clarify on the pause of the payment withholding, the payment pause, has CMS given you a sense of what the timeline is for the appeal process? Like, will it be determined by a certain date? That's it.
Okay, I'll go first. I mean, my communication with the U.S. Attorney's Office was always, unfortunately, somewhat irregular. I had sent letters to the acting U.S. Attorney, Joe Thompson, saying, hey, if you have information about fraud that I can use to suspend payments to providers, please let me know. I desperately want that information. To the extent you have information about billions of dollars in fraud, right? Remember, fraud is a crime. It's a specific crime. If prosecutors have evidence of crimes going on in our programs, I desperately wanted that information. So I sent a letter, I think, many months ago to that end. I sent a follow-up letter to Dan Rosen, the U.S. Attorney, basically with that same plea. And I just hadn't heard anything back from them in terms of actually getting me usable information that I could use, right, in my administrative role to suspend payments. So it's a long way of answering your question, saying is that communications with that office, since I've been in this role, have always kind of been irregular, infrequent. And I'll kick it to you, John.
Sure. Thanks, James. And thanks for the question. So I just want to confirm. So you're asking about the timeline for the appeal process and when we expect to move forward with that. Is that correct? Okay.
Yeah, because you said, right, that they've paused the plan to pause payments while the appeal is completed, right? So just wondering, is there a timeline? Is it like 30 days, 60 days? Do we have no idea? Yeah.
Yeah, great question. So yes, they are pausing the withholding action. So they're waiting to withhold the federal funding until we go through this appeal process. And the way this will work is, or the dates that we understand at this point, are that we will, or rather CMS is required to provide their kind of case for withholding and noncompliance to the CMS hearing officer 60 days from when the notice was published, or the appeal was published in the Federal Register. And that was in January. And so we expect that to be delivered to the hearing officer in mid-March, roughly. And so then once that happens, we will presumably receive a hearing date, but that hasn't been defined yet. So at least a couple more months until we have CMS's position on all of this and kind of their statement for why we should have a withholding applied to us and why we are out of compliance. And then we will appeal accordingly based on the information they supply.
So, John, unlikely we'll know during the legislative session, it sounds like, whether this money is being frozen or not, given the timeline you just outlined.
Unclear.
Okay, thanks, John. Thanks, James, for joining us today. I'm sorry we weren't able to get to everybody's questions. Please email me if we missed something for you or if you need something clarified. We would appreciate hearing from you. Thanks, everyone, and have a great day.